It was about 10 months ago that I famously said,
And this is Ozempic face.
and I did not like the cosmetic ramifications of Ozempic face, at least for me. I kind of have a long, drawn out face to begin with. And I even discussed some strategies like facelift and fat grafting and other things to try and combat the effects of weight loss that was induced by medications. But one of the biggest issues with Ozempic, if you guys recall, was my sort of discomfort from a GI standpoint. I think I even said it feels like somebody took the keys in my ignition and just turned my entire GI system off. And although this was an issue for me, it actually becomes relevant in the face of elective surgery. Hi everybody, I'm Dr. Jonathan Zelkin, board-certified plastic surgeon in Newport Beach, California. Routinely perform elective plastic surgery, although at times I also perform reconstructive and non-elective procedures. Today I want to talk about Ozempic again, but not just Ozempic. I'm talking about all of them, all the GLP-1 agonists, the glucagon-like peptide agonists. And what these do is they simulate secretion of insulin and things like that, which was initially designed for type 1 and type 2 diabetics, but ultimately became more relevant in the weight loss realm as well. So how does this play into my practice as a plastic surgeon? First of all, I thought it might be an opportunity for a lot of people who are losing weight finally to have body contouring procedures and face rejuvenation procedures, as one of the unpleasant side effects of weight loss is obviously excess skin that doesn't always snap back. But in reality, there's more medical risks than just discomfort and GI distress associated with Ozempic, Wegovy, Mounjaro, and the other GLP-1 agonists. So today, I want to talk about the anesthesia-associated risks of GLP-1 agonists and what we can do to prevent anesthetic-related complications associated with the GI system that has been shut down. So yes, you may notice that I've regained most of my weight back, and I'm happy, okay? I took a chance, I tried this out, I felt that it was a nice improvement. It changed some of my habits for the better. I hope there's no long-term effects, and other than some discomfort, there were no short-term side effects for me. But it gave me better perspective of what people on these GLP-1 agonists are going through. And one of the biggest, I guess, issues with these medications is the stigma that's still associated with it. Not only are they in short supply because this diabetes medication has sort of been overtaken as a weight loss drug and most pharmacies don't have it in stock, but a lot of people aren't quick to admit that they are on these medications and want to raise their hand and say, I've been really good about diet and exercise and this is how I'm losing my weight. It just so happens that during a time in our lives that these medications have become widely available. But for those who are concealing their prescription, I would advise you not to hide it, at least not with your plastic surgeon and anesthesiologist, because that same unpleasant side effect I discussed, which is frankly not being able to go to the bathroom for a week at a time, is very relevant when it comes to regurgitation and aspiration of pulmonary and gastric contents during surgery. You know, if you've ever had plastic surgery with me or anybody else, we say NPO after midnight. NPO, we don't even think about what we're saying, but what we're telling our patients is make sure your stomachs are empty. So when you are intubated, that there's no chance of you regurgitating your gastric contents upwards and aspirating them and creating some sort of lung infection or condition. So by not eating after midnight, assuming surgery starts around 7 or 8 o'clock in most patients, that gives you plenty of time to allow the gastric contents to descend into the GI system and sort of stay out of harm's way. But if you are on medications like GLP-1 agonists, and I will refrain from using brand names from here on out, you are kind of shutting your GI system down. And what that means is you are not going to have the same gastric delay or gastric emptying capacity that you had before. So it's really important that if you are on GLP-1 agonists and you're really shy about it, which you shouldn't be, you should be honest with your doctor. Number one, make sure that you hold your weekly dosing for at least a week before an elective procedure. If you're going to have a daily dosed medication like an oral pill or something like that, again, you want to hold that daily dose. And we have to take special consideration to people who are on these GLP-1 agonists, and it so happens to be a huge part of our plastic surgery patient base. So hence the relevance of this video, hence my little PSA that I wanted to present today, and hence the follow-up on my Ozempic face video from almost 10 months ago. I hope this serves you well, and I hope people have learned something. I hope I save a life. I hope I save a lung by presenting this video today. Do not be shy with your plastic surgeon or anesthesiologist. We're here to help you. We deserve to know every medication you are on. And if you are on these medications, do understand that the same uncomfortable side effect of GLP-1 agonists becomes relevant in terms of your pulmonary health and the possibility of complications and even death during surgery. So be open, leave a comment below, subscribe, like, turn your notifications on. Have a great day.